Hello, I'm Mabel Jong, and I'm very pleased to be speaking with Shayna Hoffman, President and CEO of Lucet, a leading provider of behavioral health solutions and services. Shayna, thank you so much for your time.
Thank you so much, Mabel, for having me.
Well, first of all, let's talk about access to behavioral health treatments. Is there a shortage of providers or increased complications in getting connected with a provider? And overall, what is the impact of that?
Sure, Mabel. I think when we think about access to care, you really need to look at both the demand side of what are patients looking for services and then the provider side on the supply side. And I think we've talked a lot about how there's a mismatch between those supply and demand elements where there are providers that exist. And of course, in certain rural areas, there are shortages, but it's really more about getting the right patient matched to the right provider and figuring out how do you appropriately get all of the visibility into the supply side to know where those slots are available. Are they virtual? Are they in person? What are all the different components of those providers, their gender, different preferences, different cultural dynamics, so that you can get that right patient into the provider, which we think about as being equally as important to getting that person an actual visit.
Okay. And so at Lucid, you're deploying a tech-enabled solution called Navigate and Connect. What is that? How does it work? And are you essentially connecting patients with providers more effectively, more efficiently?
Mabel, so our Navigate Connect product is essentially a product that allows us to screen, triage, and directly schedule patients into high quality behavioral health care. So we do this across multi channel. So it's for people that are calling into us through our call center. It's for people that are going into primary care settings. It's for people that are going directly on the web to look for behavioral health referrals. And at that point in time, we are doing an assessment to determine what is the level of acuity of that person and do they actually need clinical support in the moment, or are they going to be on their journey to kind of directly schedule into care. 10 to 15% of people that are looking for those services actually need clinical support in the moment. And then from there, we are getting that person matched again based on their clinical acuity, all of their different preferences of geography, language, cultural preferences to a provider that's going to be the right fit for them. On the other side of that, we are putting together a supply side of providers where we put providers that are local in the network for the health plan. We stack in other national aggregator models into that. We stack in specialty specific providers for eating disorders, child and adolescent. And all of those are who those patients are getting matched to. And then the last component we talk about is access without quality is not helpful, right? And so it's the quality monitoring and measurement for those providers on the other side. So part of our platform allows us to both measure in the platform or ingest data from those providers to determine how well are they doing on treating those members.
And who are your customers?
So our customers are health plans. So we're working with health plans to deploy this solution across their member populations. And our kind of key stakeholders are really the health plan, the member, and the provider. And we really think about that triangle and kind of providing solutions across all three of those.
You mentioned a little bit about cost savings. Can you be more specific on what these health plans are experiencing and how long does it take for them to really see a difference in their bottom line in this area?
Yeah, so the interesting thing about behavioral health is that it has an impact on medical expense, right? So it's what we call a force multiplier on medical expense. So, for example, the same patient that has diabetes and depression versus a diabetes patient without depression costs a lot more to a health plan. And also, it's much harder to treat those diabetes if that person hasn't addressed their depression. Right. So that's kind of what we're focused on is the medical expense reduction. And we've done kind of studies in partnership with the Validation Institute to look at the total cost savings on the medical side for patients that we are actually getting into those behavioral health interventions. And we actually know at the exact kind of condition level who drives the most spend and who's most critical to drive into behavioral health services, which is really unique for our company to be able to do that.
Mhm. You went through the process of getting validated with the Validation Institute. Why was that important? Why go through that?
So, because behavioral health has an impact on medical cost savings, you have to be able to tie kind of your interventions to those cost savings. And so for health plans, it's really important to have kind of a third party validation to say that, yes, you are doing kind of this in a statistically significant way, where you're looking at cohorts that are equivalent, and it's actually your connection to care, your Navigate Connect product that's driving those cost savings versus other things that are going on with that population. So it lends a lot of credibility to us, particularly as we look to bring on new health plans in our sales process.
Shana Hoffman, President and CEO of Lucet. Thank you so much.
Thank you, Mabel.